Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with our weekly podcast and Doctor's Note. Today we're going to talk about something really cool that I've been doing for a little over a year in my office for several different conditions. It's called Extracorporeal, which means outside the body, shock wave therapy. And if you Google it through the Mayo Clinic, you'll notice all the neat treatments that it can do to heal things. Now, the main way we started with this thing, it's a $40,000 machine that I purchased, was for treatments for erectile dysfunction. And we've used it hundreds and hundreds of times, and it works really well for that. But what it is, it's actually acoustic sound wave therapy that's painless, that increases circulation, breaks up calcifications in the circulation, and also in the tendons and perhaps the joints. So, I do a lot of sports medicine. I'm board certified in sports medicine as well. And we've started to use this for injured soft tissue things to decrease pain and speed the healing of things. It's great for chronic tendinopathies. Like that tennis elbow that you just can't get rid of. It also works really well for rotator cuffs, golfer's elbow, hamstrings that tend to lag and be chronic. It works for your glutes. It works for your quads, Achilles. It's FDA approved both for plantar fasciitis and also patellar tendonitis on the knee. Ernie Dixon, who is a 35-year experienced physical therapist. Many of you know Ernie. He works in the office, and he uses this in quite a great way. He has all these other modalities that he treats people with. He's amazing in that he can figure out what's wrong with you as far as asymmetries and things and what's leading to this injury or chronic problem. Like for me, example, I've had some shoulder problems, and it really wasn't my shoulder so much as it was a tight pec and weak scapular muscles. So he really figures it out, and then he treats it and gives you a set of exercises that you can do to strengthen yourself up a little bit, and that way you won't have all these chronic pain and tendinopathies. But so it really works well for the first place we started using it for, besides erectile dysfunction, was for plantar fasciitis, and really it's just an amazing treatment for that. I mean, think about it. It doesn't involve needles or surgery. So if you have an injury that just won't get better, come up and see me or Ernie, and this may be an option for you. Like I say, Ernie does a lot of other cool stuff too, like dry needling, cupping, ultrasound therapy. But this machine is kind of unique and something not a lot of people know about. It's commonly used to dissolve kidney stones. It's called lithotripsy. That's a much more powerful machine than what's used for these other functions that we use it for. But what it does is it causes a cellular response leading to tissue rejuvenation, and that's what we're all looking for. Most people that come to the doctor come for one of two reasons. Either they hurt or they're tired. And so, as you get older, your life, especially if you're exercising or even if you're not moving, which is the worst thing you can do, you can come along with these nagging injuries. So as you get older, in my baby boomer generation, it seems like if you're really active, lifting weights, biking, running, maybe stretching, doing yoga, swimming, it seems like we do come down with more of these little inflammatory responses. But this is a really good option that you can look at, and we'll be glad to look at you and kind of evaluate your injury or chronic pain and then do something about it. Like I say, we've had a tremendous response for it for erectile dysfunction, and there's another popular treatment that you've probably all seen in the news. It's promoted their shockwave therapy. And the thing about us, we don't call it that because by not doing it that, we call it a his wave treatment. We can do it for less than half of the price you could for the one you always hear about in the news for erectile dysfunction. So we've had great results from it. Usually you get 2 treatments a week for 3 weeks. And, because doing men's health, it's a lot of what I do is not only hormonal deficits and treat that, but also erectile dysfunction, which is a circulatory problem most of the time. I hope this is helpful to you. If you have any of these problems, please don't hesitate to come see us at Performance Medicine, and we'll help you in a speedy recovery and to feel better in every way as you age. Thank you. We'll talk next week.